her and her family have been taking like college courses while they were in high school. So by the time they finished high school, I mean, they were already more than set. With her being 17, that means she did a lot of hustling when she was in high school alone. There are 10 of them in the family. 10 of them in the family. 3 have already graduated, 2 in ultrasound, 1 in dental hygiene. One of them is in med school. She's in the X-ray program. The 2 other sisters are going to dental hygiene and I think also ultrasound, and the rest are boys. Okay, the remainder are boys, and they're all going to go into also medicine. Actually ran into one of her brothers the other day. He's 8 years old. I said, oh, what are you going to do? He was telling me about his brother who was in UC Riverside right now in med school. I said, what are you going to do? I said, what do you want to be when you grow up? He says, I'm going to be a neurosurgeon.
At 8 years old, you want to be a neurosurgeon.
8 years old, right? Okay, so yeah, so at least 18 years old. She turned 18, by the way, by the time we started sending, because she couldn't do her clinical work until she turned 18, and she did turn 18 before we sent her out, so that was fine. All right, so here's an example of the amount of radiation that you can receive during your lifetime as a technologist. So here we have an example of a 29-year-old technologist that is allowed a cumulative exposure of 29,000 millirems, or let's just talk rems, 29 rems. Okay, this is what she can receive in her lifetime. Okay, if you do 5, 5, 5, 5 each time. But here's the key. Again, 5 is your limit. So there is no such thing as rollover. Just because you didn't use up 3 or 4 your previous year doesn't mean that it's going to allow you 3 or more the next time. You don't get that allowance. Okay? So you can figure out the cumulative, but just remember again the concept of not exceeding 5 in a given year. Okay? All right, here are your cardinal rules. Cardinal rules to what? ALARA, remember, as low as reasonably allowable. These are the 3 principles. You already told me what they were. Time, minimal time around a source. Distance, as far away from the source as possible. Shielding. What is the minimum amount of shielding that is required for you to wear if you are in an X-ray room? 0.25
of lead
millimeters of
lead equivalent.
lead or lead equivalency. What is your minimum distance if you happen to be in the procedural room?
6 feet.
At least 6 feet from
The source.
the source. Who's the source?
X-ray tube.
X-ray tube and
Patient.
the patient. All right. So let's go back to shielding. Let's talk about the barriers that protects us if we're not in the room. So our walls here have to be constructed in a way to protect those outside of the procedural rooms. Okay? Because outside of this room, this could be the waiting room. It could be the operating room. It could be the holding room. Okay? It can be the hallway to the cafeteria. Okay? We need to protect the outside environment. So we have 2 different types of barriers. We have your primary barrier and you have your secondary barrier. What is your primary barrier for? To protect you from what?
Primary beam.
The primary beam. So any wall in which the X-ray tube can be pointed or directed to has to be a primary barrier. The minimum requirements is 1/16 of lead or equivalent, which again means that it doesn't have to be lead, but it can be any type of material that has the same attenuating properties of 1/16 of lead. It can be concrete. It can be wood. You understand where I'm going with that? Okay? Same attenuating properties.
That's 1/16 inches of lead, right?
1/16 of lead.
But is it,
Right.
is it
But
inches?
if you have an equivalent of lead, then you got to have the material that you're going to use has to have the same properties of 1/16 of lead. It may be 2 inches of concrete. It may be 3.5 inches of aluminum, or whatever it is. Okay, but it has to have this property right here, 1/16 of lead. All right. Now your primary barrier is going to start off at the floor and go as high up as 6.6 feet. That's your primary minimum height. From the floor to about 6.6 feet in height. Okay? Secondary barrier, what's that?
Scatter radiation.
Protect you from scatter radiation and what's the other one?
Leakage.
Leakage radiation. So this protects you from scatter radiation and leakage radiation. So this is going to be half of that, 1/32 of an inch of lead or lead equivalent. So here's your 6.6 feet of primary. Your secondary is going to start off about, what does it say here? A half an inch right below that because we want overlap. And then it's going to go all the way up to the ceiling. Okay? So your primary and secondary are going to overlap with about a half an inch. Primary from the floor, secondary on its way all the way up to the ceiling. Any questions? Okay. We, as operators, we should be provided with a protective barrier in a separate room. If not, a protective booth. And if not, there is a shielding between us and the source to protect us from both the primary and secondary radiation. There has to be a provision for a line of communication. One of it would be a window. You can see like in our procedure rooms we have windows. Does it look like it's made of solid material? No. But it has the same attenuating properties as, because this is a primary wall, it has the same primary characteristics as 1/16 of an inch of lead. So it's a really thick glass. Okay? And there's probably some radiolucent material embedded in it to also have the same attenuating properties. All right? There also should be a line of communication where you can vocalize from one person to the next, from outside of the room and inside of the room. All right, let's talk about the pregnant or potentially pregnant patient. This you are familiar with. A biological risk will always exist in which a radiologic examination is conducted based on these three assumptions. There is always going to be a small potential for an adverse biological effect. Number two, there is no threshold for such effect. And number three, such effects are directly proportional to the amount of radiation received. What are we talking about here, guys? What concept is
the
that?
dose effect.
Your linear, non-threshold
dose effect.
Dose effect. Okay, this is what we're talking about here. So when we have anybody, any females, and I'm going to be specific to this, we're talking about females, not males. Females, any females coming to our department of childbearing years, one of the questions I'm going to ask them is, when was your last menstrual period? Or / when was the last time you had your period? Okay, because if they are bearing, the chances of biological effects, not only to her but her child, is going to go up, right? So we're going to ask our female patients, whoever comes in of childbearing years, is there any chance of you being pregnant? And what we used to follow is what's known as the 10-day rule. So the 10-day rule says that it is safe to do an abdominal pelvic examination, because this is where your ovaries are, right? This is where your uterus is, right? Okay? So abdominal pelvic x-ray exams only during the 10 days following the onset of menstruation. Following the 10 days onset of menstruation. But we also know now, because we're more knowledgeable, that even after you had your period, there's still that window. Okay? Can you get pregnant even when you're on your period?
Yeah.
Mm-hmm. All right. So we've kind of given it a little extension here. Now what we've done here is known as the 28-day rule, and this is common practice. So it says here the examination may proceed if the patient states she is not pregnant and has had a period within the last 28 days. Because after the last 28 days, then we know, oh, there's no chance. There's just no chance. Okay, So, initial examination rooms, you should, and signs all over radiology. If you are pregnant or think that you might be pregnant, please tell the technologist. Because I'm not protecting you, I'm protecting your child, unborn child. So, you asked the question of any woman of childbearing years. Is there a possibility of being pregnant, or when was your last known? LKMP stands for last known menstrual period. Who am I going to ask this to? What's the age range?
It's like crazy.
11.
Yeah.
11. Or probably
So, I'm going to tell you a story, and this was a lesson learned. Back when I was shooting x-rays, again, probably before some of you guys were born, I had an 11-year-old present to me in the ER, was working the second shift, present in the ER with abdominal pain, so I got an order to do an abdominal x-ray. So the child was complaining of just abdominal pains, and she's had it for a while. All right, so 11-year-old, I'm not going to ask her any type of question. I'm just going to put her in the room. Her family, her mom and dad followed her with me to the department. Again, it's skeleton crew, no pun intended, it's x-ray, right? Skeleton crew, so there's only like 2 of us working in radiology at that time. So I brought her in. After we had her settled on the table for the x-ray, I asked the parents to leave the room. And because it was an abdominal x-ray, I could not shield her, okay, because I'm shooting here. And I shot the x-ray. Film at that time, we didn't have computerized radiography, so the film came out, and I hung the film on my viewer, and I did this. Took the film, flipped it, heck, and it just didn't look right to me. And so after I thought out of the box, I looked at it again, and there was a nearly full-term child in her belly.
No way.
Yeah, skeleton and all. Okay. So I saw the outline of the head and the spine and the arms and the legs. And I said, "What is all this mess in here?" Well, it's the bones, it's the skeletal bones, anatomy
And
of
she
the
wasn't
child.
really showing like much as.
She was chubby. She looked like any typical 11-year-old, maybe some, extra baby fat.
Wow.
Okay. So I said, all right, parents are asking me, how do x-rays look? I said, well, let's go back to the emergency room. I said, the doctor will talk with you guys in a little bit. Because as technologists, you're not allowed to say anything, right?
Mhm.
How does it look? Even though I said it looks good, right, because they can misconstrue us saying, oh, there's nothing wrong with
Right.
me. Okay, semantics, so you can get in trouble for semantics. Your x-rays look good. What I'm saying is, oh, my pictures are great. But that's not what they heard.
Right.
They heard like, oh, I'm good, there's nothing wrong. Okay? So I go back to the ER, put them back in the room with the parents, and then I went to the doctor's viewing room, and I hung up the film. Okay. Step back here. He stood over here. Did the same thing. And next thing he says was, "What?" I said, "Right?" He goes, "Really?" I said, "Yeah." She goes, "How old is she?" I said, 11. She goes, "Oh my God." I said, "That's why you got the MD after your name? Go talk to the parents."
Wow.
Yeah, so she was full term. So yeah, getting ready to give birth, and
Wow.
so it just makes you think. What is considered childbearing years?
It
You're
varies,
right?
right?
11.
Yeah.
It could be 10. It could be 9. Right? So you have to be careful when asking these questions, especially around like family members. Is there any chance of you being pregnant? No. They're not going to say that. They're not going to admit it in front of the parents, because admitting to that would be like, well, yeah, because I'm sexually active, right? So it's kind of it's odd, and you got to watch what you say. So what I've gotten in the habit of asking these now is, when was the last time you had your period? And they can either say, oh, it was a few days ago. It's like, oh, I haven't started my period yet. Okay? Now, the other side of this too is, I can ask somebody who's an adult, and I said, is there any chance of you being pregnant? And they tell me no, okay? But they are. Didn't I CYA though? You know what CYA is, right? Cover your what? Cover your assets, right? I asked her and she said no. Well, it protects me because I did ask her if she was pregnant. So if she was pregnant and I took the x-ray, she said she wasn't pregnant. I'm good, I'm covered. So anyways, going back to what I was saying is, ask them. Last no menstrual period. If they are pregnant, so if they do admit that they're pregnant or possibly maybe pregnant, stop what you're doing, okay? Because you don't want to take an x-ray, you want to stop what you're doing. You may postpone the procedure. You want to talk to the doctor first, so they may postpone the procedure. If it's life or death, they may want to do it right there and then, okay? If they want to do it, then we'll do what's called a limited study, because most of our studies, let's just say, are about 3 x-rays, okay? And you want a limited study, we're just going to do half of that. Not 1 and half, we'll just do like 1 picture. Okay, if it requires 2 pictures, we'll do 1. Okay? Limited study. Or, again, we'll just wait. But again, there might be some life and death situations. There have been times when I work in the cardiac cath lab, I've had, pregnant mothers who had a full-blown heart attack 3 months into pregnancy. They came in for some kind of condition and they're pregnant. And now they're having a heart attack. What are you going to do? You got to do it. You got to do what you can to protect that mother. Okay? You got to save her life and possibly not take the chance of maybe, hurting the fetus. And especially if we're dealing with the heart, we're up here anyways, so we can still protect down here. But again, it's life or death. So hopefully here we can protect, we can save the mom and the baby, but let's save the mom.
Because if the mom dies, they both die anyways.
Exactly. So this is kind of like where the ethical and moral concepts come into play. What do you do? And again, that's why I'm not an MD, because I can't make those decisions. All right, so if you do have to x-ray the mother, keep it in the last trimester. Why the last trimester?
The baby is almost fully
Because
developed.
the baby is fully developed. All right, next point. Termination or interruption of a pregnancy is never justified because of exposure of an embryo fetus to a diagnostic x-ray examination. I know it sounds like a lot of English, right? A lot of big words. What it's saying there, and the reason I put this up here because this is it is a set of terms that you'll see over and over and over again, regardless of what textbook you pick up. There's always going to be that small paragraph that says termination or interruption of pregnancy is never justified because of exposure of an embryo fetus to a diagnostic x-ray examination. Plainly what that means is if somebody loses a baby right after an x-ray procedure, it's most likely not because of an x-ray procedure, because we don't use that level of x-ray exposure. That the child or embryo may have died of other conditions. But it's never alone. We may have been part of it, but it's never solely or exclusively on an x-ray examination alone. Okay? Now the risk of the embryo fetus is considered to be negligible or not significant at 5 rads or less when compared to other types of risks. So we're talking about 5 rads or less, we're cool. There shouldn't be any type of injury to the embryo fetus. Now, once you start approaching 15, 6, 7, 8, now you're increasing the chances, 9, 10, you're still increasing the chances, but you're still within a threshold. The threshold here is going to be 15 rads. We know for a fact that beyond 15 rads, there is going to be some type of effect and damage to that embryo or fetus. And again, I think I mentioned this before, we don't know this based on human experiment. We know this through history, through the different types of nuclear accidents, the bombing in Japan. Okay, Chernobyl, Fukushima. Okay, the recent nuclear plant disaster in Japan, about what was it, like 6-7 years ago now? Okay, Marshall Islands. Those are the things, these are a result of what we know from these nuclear and radiation disasters. Okay, let's talk about the occupationally pregnant woman. Occupationally pregnant woman. If the technologist decides that they want to continue working during the pregnancy, fine, as long as they can follow these guidelines. Exposure to the fetus shall not exceed 0.05 grams in any given month. So you're allowed 0.05 in every given month. How are we going to measure that?
The badge,
Where?
the collar, on the belly,
Oh, in the belly, right? Outside or inside?
inside.
Inside the apron. Okay, so we're going to measure 0.05 in any given month.
So they wear 2 badges, one for them.
Right, one for them, one for the baby. Okay? And then this is for every month. Now for the entire gestational period, approximately 9 months, give or take, you cannot exceed 0.5. 0.5 grams. 0.05 for every month, 0.5 for the entire gestational period. Okay? So again, if the pregnant technologist decides to work, there are other options. All right, if you want to continue working in X-ray, maybe you shouldn't for the first 2 trimesters, 3, 4, 5, 6 months. Okay, because that's when the developing child is going to be the most sensitive. All right. But again, you're receiving less than the mother is because apron, and they're also going to be protected by all the tissue around them. You may want to be, relocated doing something else. What else does it say here? At present occupational dose, okay. There's no need to be concerned about sterility. And again, this just reiterates what I said before, 0.05 for any given month and then 0.5 for the entire period. All right, so your options, wait, get reassigned, make sure you wear protective aprons, avoid any type of procedures that requires any type of holding of patients or having to be in the room during the procedure. Okay? But we know what can and cannot happen, so they'll also be in full understanding of how to protect themselves and the child. Okay? All right, I think that's the last part, right? Gonadal shielding. What's the purpose of gonadal shielding? Are we protecting the patient or the future generation?
Future generations.
Okay. So important in the protection of patients due to reduce unnecessary exposure to the gonads. A gonad shield is any material placed between the X-ray source and the gonads that attenuates radiation to the required degree. It is said that you should, bless you, wear a gonadal shielding if the gonads are within 2 inches or 5 centimeters of the primary beam. That's usually abdominal type of X-rays, pelvic and hip X-rays. Okay? If I'm X-raying the chest, the neck, the head, my hands, my extremities, I'm out of range. So there's no need for me to protect them. Yes or no? I still should. Even though it's not within 2 or 5 centimeters, 2 inches or 5 centimeters of the primary beam, I'm still going to throw a gonadal shield over them. Why? To let them know that I care. Right, just to be considerate, because they don't have the education that I do, which is, again, I'm protecting your future generation, not you, but they don't understand that. So you just throw a shield on them. I throw shields on 75-year-olds. Why? Because they watch a lot of movies and they know that if you're exposed to radiation, you mutate. Right? That's why we do it. So again, we're just protecting future generation, but I tell my students, just shield everybody. If you shield everybody, it becomes habit and you don't have to think twice. It's just part of what you do on a daily basis. It's habit. It's habit forming. Okay? Twice is that of protective aprons. Protective aprons are what? 0.25. Gonadal shielding is going to be 0.5. So let's talk about the different types of shielding. The first one here is a flat shield. The flat shield, 0.5 millimeters of lead or lead equivalency. You just lay it on top of their groin area. Lower for the men, abdominal area for the females. Okay, it's flat, which means that these are only good when doing x-rays when the patient is flat, on their back or on their belly. Now if I was on my side, whoop, whoop, if I was standing up, okay, so they have to be taped on or fastened on in some way. These aren't good, especially if you're doing fluoroscopic procedures. In fluoroscopic procedures, this is what's happening, is we'll tilt the table up, the patient may be moving in different directions, and so the shielding keeps constantly moving out of place. So each time it moves, you gotta move it back to cover the gonads. Okay? So it's a little bit more, a little bit more manhandling and more involved in trying to make sure they're protected, but it still works. Next one here is a shape shield or contact shield. Designed for men, boys. Looks just like a supporter cup to protect the male gonads, and can be worn with some type of supporter. I think I got one here. Someone keeps moving it. Somebody thinks it's a toy and you keep playing with it. Right here, guys. Okay, shaped contact. For males, comes in different sizes, usually the same shape, but because it's contoured, it doesn't matter which way you move, it stays in place. Okay? These are good for fluoroscopic procedures. Okay? Last one here is the shadow shield. The shadow shield is a lead plate that you place in the path of the primary beam, and it's attached to the x-ray tube. So wherever the shadow is displayed on the patient, you just move their groin underneath that shadow, right? I'm going to put my groin right underneath the shadow. Okay? So you got the primary beam all the way around, but wherever the shadow is, that area is being protected. Okay? This avoids any type of embarrassment for both patient and operator if you're having to constantly move the shield around, especially with the flat shield. But the problem with this is that every time the patient moves, you gotta move them back underneath the shadow, right? Keep constantly trying to move them back underneath the shadow. This is good when you're doing any type of surgical type of procedures. You were using sterile procedures, so you're not constantly touching that area and contaminating it. So this is good for surgical or surgical aseptic type of procedures. Last one, half value layer. What is the purpose of the filter?
To minimize the exposure of the patient.
How are we minimizing the exposure? I also said something about hardening the beam.
Filtering out low-level
Yeah.
X-rays.
So remember, the X-rays produced up in the X-ray tube is going to be polyenergetic. So the primary beam is going to be composed of photons of different energies, high and low. The purpose of the filter is to remove any of those low energy photons, making the beam more uniform and more hard. This concept is known as the half value layer. Okay? The half value layer doesn't refer to something physical. What it does is that explains that it's any type of material that will reduce the original intensity by half the value. And it's doing that by removing the softer photons. All right, so it doesn't just have to be aluminum, it can also be of any material that has the same filtering and attenuating properties as the material of choice. And then when you guys get into radiobiology, there are different other types of layers that we'll talk about. It's not just the half value layer, but there's also the 4th layer and the 10th layer. All right, any questions? All right. So, example